I mean, I'm not in support of middle-class families paying more taxes for it.
And that's what I actually was hoping to talk to you about. You just said that you were not in favor of a middle-class tax hike.
Yes, correct.
How do you propose to pay for your version of Medicare for All, if it resembles what Senator Sanders is proposing?
Part of it is going to have to be about Wall Street paying more. It's going to have to be about looking at how we and what we tax in terms of financial services. That's part of it. But the other part of it is to understand that this is about an investment which will reap a great return on the investment. We can't only look at this issue in terms of cost without thinking about benefit. The benefit to the American public will be that people will have access to health care that right now they cannot afford. And we are all paying a price for that.
Well, Senator Sanders says that is impossible to achieve without a middle-class tax hike.
I'm not prepared to engage in a middle-class tax hike.
But in many studies, study after study shows it would cost approximately $30 million over a decade to pay for this. So taxing Wall Street will reap $30 trillion in order to cover this?
What we're doing right now is unaffordable to so many American families. And the idea that we're going to go down and this level of analysis that suggests that status quo is okay is completely unacceptable.
So people who have private insurance would eventually have to give that up under your plan?
They would eventually be covered under Medicare for All, and they would still see their doctor, and that's what they want.
How long will this transition take?
I think the transition is going to have to take, I mean, the bill is 4 years. I think it's going to have to take more than that, to be honest with you. Yeah.
And all of this done without a middle-class tax hike?
Without a middle-class tax hike, yes.
$30 trillion over 10 years.
There are ways to pay for it, also understanding the investment that we are going to be making in a way that is going to reap great benefits in terms of other costs.
The investment where?
In American health and what we are otherwise paying as a cost for people not having access to health care and the burdens that places on systems across the board when people don't have access to health care.
And when people question that there is no formula for this, that you are going to find money in magical ways, is not realistic thinking. How do you respond to that?
Status quo is not enough. So we have to be open to challenging status quo so that everyone has access to health care and price is not the is not the barrier. We have to agree that what's happening right now is not affordable to many, many working families.
Well, Joe Biden says